Okay, hello everyone, and in this case of the month, we have an 80-year-old male with an um, a cutaneous nodule in the inguinal area. So what we have is a 1 to 2 centimeter nodule, mainly involving the dermis, and as you see here, we have an ulceration. But in the first look, we may have an ulceration in a lesion in the located at the inguinal area may have a traumatic ulceration, but ulceration in a dermal nodule is always alarming. So the other thing is we have this well circumscribed nodule, and in the dermal area we have less circumscription here, and the lesion becomes hazy. The borders become hazy in this area, but at the bottom we have a dense inflammatory infiltrate around the nodule, and it is at this low power field we may suspect of angiomatoid fibrous histiocytoma with this kind of lymph node like look. But when we come to higher magnification, let's go start from the upper part, and here is the ulcerated area, and we see that these cells has a spindle morphology, and this is just the border of the lesion, and we have this collagen trapping of the lesion that reminds us the benign fibrous histiocytoma. And when we look at the cells, they also have a fibrohistiocytic look, but there are a few mitosis, and the next thing for the cytology, actually the cells doesn't look like malignant at all. They have a very fibrohistiocytic look, and they have a even chromatin. Some of them may have inconspicuous nucleoli, and there are some scattered mitosis just at the center, and we want, and so you can see some storiform pattern, but actually this lesion has more like sweeping fascicles instead of storiform pattern. But you can also see some dermal collagen here, and here at the center we have this fibrotic area, and everything looks perfect for benign fibrous histiocytoma, but we expect some giant cells, but we don't have here. We don't see any giant cells, and the main differential diagnosis is in this type of lesion is benign fibrous histiocytoma, or some maybe a spindle cell carcinoma, but the cells doesn't look like so much malignant, and we may also consider some kind of dermatofibrosarcoma protuberance, but it's not easy to find mitosis in that kind of lesion, and we don't see any honeycombing here. And we did some stains, and of course malignant melanoma spindle cell I'm sorry, the spindle cell melanoma may look like this, but here this is S100 staining, and this is negative, and the stained cells are they seem to be the accompanying dendritic cells. And CD34, which is negative, and then we decided to INI1 because epithelial sarcoma may have may contain such spindle cells of benign looking, but this is INI1 and nice internal control, and the cells retain the INI1. So what we did is, next, this is keratin, and the lesional cells diffusely expressed cytokeratin. And of course CAM 5.2 here. This is in CAM 5.2. We have diffuse keratin expression. So we decided to look at the history, and we learned that the patient had already malignant mesothelioma in his medical history, and this lesion became to be a metastatic mesothelioma. And now I'm going to show the coloretin staining here, and these cells are positive for coloretin. Both cytoplasmic and nuclear staining is very diagnostic for mesothelioma in this circumstance.